Okay, now it's recording. Okay, so we start with hand washing and or hand sanitizer before entering the patient's room. Hello, my name is Victoria. I'm an F&P student with United States University, and today I have with me my daughter Cadence. But Cadence, would it be okay for me to record you and upload it for my instructor to be able to grade it on YouTube?
Yes.
Okay, so today we're doing range of motion and the musculoskeletal system. So obviously this is done bilaterally, but we're going to do one side at a time, and then we'll compare them is what we're going to do. So we start with the patient's hands, and we are looking at them to make sure and see if there's any redness, swelling, any signs of atrophy, and we're looking for symmetry in the hands. All right, once we find that, we kind of palpate the hands to check for any nodules. We're feeling those distal and proximal, interphalangeal, and metaphalangeal bones. Okay, let's go ahead and come over here. All right, Cadence, can you go ahead and make a fist? Perfect, and open them up. Awesome. Okay, what about flexing your hands up and down, like your fingers up and down? Can you do that? Perfect. Awesome, thank you. Okay, what about abducting your fingers open and adducting them together? Awesome, thank you. Next one we're gonna do is the wrist. So again, we're checking for any swelling, any abnormalities, deformities, redness. Again, we're checking to see that they're symmetrical with each other, which they are, okay? And we're feeling for the metacarpals and the carpals, making sure that the patient doesn't have any pain or discomfort when we're doing that. Okay, we're gonna do some range of motion now. So with this, are you able to rotate your wrists? Perfect, okay. What about, let's see, raising them up and down more so at your hands? There we go, perfect. Okay, and then we take and we are going to do something called the Tennel sign. And so with that, we put the hand down to make that medial nerve kind of pop, and then we tap it to make sure if the patient has any pain or discomfort with that. And if the answer is no, that's a good thing. Obviously, we don't want pain or discomfort. But the next specialty test is called a phalange sign, where we flex the hand, we flex the wrist for at 90 degrees for 40 to 60 seconds, and we hold it in that position. I'm not going to model for the whole length of time this time, just for her comfort right now, and for, but we would leave it in that position, both sides one at a time, as we're evaluating to see if she has any pain or any signs of like numbness or tingling along that nerve line. Okay, so from there we move on up to the elbows, and with the elbows again, we're checking to see if there is any redness, swelling. We're checking what's called the extensor surface, which is the hard part of the elbow, to make sure it's not feeling mushy. We're doing that on both sides. We're also checking for symmetry to make sure that they're basically feeling the same there. Okay, any pain or discomfort when I'm pushing on you? No? Okay, perfect. So what we're gonna do with these is we're going to flex our arms up this direction, perfect, and extend them out. Awesome. Now put your arms straight out in front of you like this, and holding them up is called supination, and we're gonna dump them down and go pronation, and then back up to supination. Perfect, we're checking the rotation of those elbows. Next, we move on to the shoulders, and with the shoulders, we're checking again for any signs of swelling, redness, atrophy, nodules. Again, checking to see that they're symmetrical. I'm not trying to tickle you, I'm sorry. Any tenderness or anything when I'm kind of palpating on here? No, perfect. Okay, so what we're going to do with this is we are going to go ahead and we're going to flex our arms forward. So if you can, take your arms and put them in front of you. Perfect. Okay, and then you'll probably have to stand up. Put them right behind your back. That works too. Okay, perfect. And then we're going to go from the side, what's called abducting them. So take them away about 90 degrees, and then we're going to add them back for adduction. Perfect. Okay, and then we're going to, if you can you raise your hands up and put them like at the small, like at the base of your neck there. Perfect, checking for that. And then go ahead and rotate them down and put them like in your back here. Perfect. Okay, awesome. So with the shoulders also, go ahead and pivot so we can see the camera a little bit, or so the camera can see your back, it's more of what I need to see a little bit of. Okay, I'm gonna move your hair a little bit out of the way here, sorry. We're also kind of feeling for the trapezius muscle that's kind of going down and around. We're feeling for like the bursa. It's probably easier to see more at this angle here. Okay, where the bicep groove is in the arm. And the tubercle of the humerus, kind of where it connects up into that shoulder area itself. And then the coracoid process, which, let's turn this way again. Sorry, you turned a little too far, I had you turn. Which is kind of right here along the front here. Okay, perfect. Okay, so another test, a specialty test for shoulders is called a painful arc. And so with your hands out inside, my watch, sorry, I didn't mean to hit it. Go straight up and over your head. Perfect. When we do that, we're checking for bursa or a pinched rotator cuff tendon. Okay, so now we're gonna move on to head and neck. So with our head and neck, sorry, we're going to take and we're gonna feel the TMJ for tenderness. Any pain or discomfort with that? No? Okay, and then when we're checking for TMJ, go ahead and open your jaw. We do the 3 fingers to make sure that it's open all the way. Perfect. All right, and then in the front here, we check for the sternoclavicular, any pain or tenderness. No, ticklish, I know. Okay, now let's turn around. We're gonna elaborate a little bit more on the spinal area back here as well. So down here we have like the cervical spine, which is the upper spinal region of a patient's back. Then we have the trapezius muscle that kind of goes across. You also have your rhomboid muscles. There's a minor and a major. Now you can kind of feel separated there. Okay, perfect. Now let's turn back this way. We're gonna do some range of motion of the neck. Can you go ahead and put your chin down to your, there you go, to your chest, perfect. Can you extend it back up a little bit? What about turning it side to side? Perfect. And then what about rotating it left and right? Perfect. Okay. And then go ahead, we showed already that we could open our mouth, but open your jaw, close it, and then you're gonna go side to side. To try to rotate that bottom jaw, just to kind of check those muscles. Okay, so next we're going to do what's called a specialty test, and this is a test that you would not do on an elderly person or someone who is frail, but it's called the Sperling's test. And so you have the patient gently tilt their head to the side and look up just so ever so slightly, and you apply gentle pressure to the top of the head just to check if there's any pain or discomfort. And you would kind of do that, look up, again checking. You would not do that again on someone who is frail or elderly. All right, so now we get to move on to lower extremities. So we start with the feet and the toes. I'm gonna raise them up so we can hopefully see them on the camera. So we are inspecting the feet for signs of redness, swelling, any corns. We're looking for plantar warts on the bottom. What? Oh. We're checking for calluses. And if there was any nodules that would be present. So let me set that one too. Perfect. Again, checking, visualizing, and kind of feeling around. We're feeling for what's called Morton's neuroma or plantar fasciitis as well. Okay, as well as the distal and proximal interphalanges and metacarpals. Okay. All right, Cadence, can you go ahead and stand up for me? I'm going to check to see if your feet are flat on the ground. She is not flat-footed. She does have the arch, so we did check for that. Go ahead and sit back down. Okay, on your toes, we're going to lift them up so that way they see them on the camera, but can you wrinkle or put them together? Perfect. You're flexing them and extending them. Perfect. And then we're going to invert and evert your foot just for rotation purposes. Perfect. Let's do this one as well. Toes, flex, extend. Awesome. Invert, evert. Perfect. Okay. Now we're going to move on to ankles. So again, with ankles, we're checking for symmetry to see how they are. We're going to palpate to see if we feel any nodules, any forms of swelling. See if we see any discoloration in there. We're feeling for the Achilles, which runs across, and the medial and lateral muscles that kind of go on the side here. Okay, we're gonna do some movements with this. So dorsiflex and plantar flex. I should probably keep this up so we can see. Can you go ahead and pull your feet up towards your nose? Perfect. Push them down like a pedal. Awesome. And then can you make a circle with your feet? Perfect. All right, so then we're gonna do the same thing on here. So again, I'm feeling for the Achilles and the medial and lateral. Okay, go ahead and pull your toes towards your nose, push the pedal, and make a circle. Perfect, thank you. So that's how we check range of motion in your ankles. All right, so next we move on to the knee area. So with the knees, again, we're checking for symmetry. We're checking to see if there's any signs of redness, swelling. We're gonna palpate as well. We want to make sure that we are feeling what's called the popliteal fossa, which is in the back of the knee. It's almost like a diamond shape, and that's a common area for a Baker's cyst. So that's part of feeling that. We're also going to, I'm feeling both of them, feel the patella directly, which is right here on the top of the knee. A little vibration. Inside, just under like the patella, there is a suprapatellar pouch. Sometimes that gets excess fluid in that, but we're just kind of feeling to make sure if we can feel that. Okay, and we're checking the sides of the patella as well. Perfect. All right, we're gonna do some range of motion with your knees now. Okay, so can you go ahead and stick your knees out straight in front of you? Perfect. And can you flex them back? Maybe stand up for this part so you can flex them back a little bit further. So lift them up towards the back. How far can you go? You can go pretty far because you're a cheerleader. Okay, what about the other side? Perfect. Oh, okay, we can crack them too. All right, let's scoot back here. The next few exams are going to require us to lay down for this, okay? Go ahead and lay back. So we're going to start with what's called the valgus and the varus stress test. It's a two-part movement. So with it, we're checking the knees first, so we gently support the knee, and we're just going to kind of rotate. And so when you go inward, this is outward when we are adducting the joint there, and then the varus is when we are adducting it. So it's abduct, and so that's valgus and varus. All right, so then the next part here, is the Lachman's test. And you just hold the femur and you're kind of gently pushing down on the tibia as well to kind of see if there's any laxity. I'm going to do this side for the valgus and the varus as well because we didn't do that one. You can go ahead and lay that down. And so we just kind of rotate again to make sure. And then the Lachman's, where we're kind of pressing down to see. Okay, perfect. Alrighty, and then we have one other test that we're going to, or two actually. The drawer test is what it's called, so go ahead, I'll start with this one. We're going to lay it down. This one we're going to sit up here. I'm going to gently sit on your toes, just on the very tip, more for support here. And what we're doing is we're checking to check for the elasticity and the laxity of the muscle here. Any pain or discomfort when I do that? No? Okay. And then we're going to do the other side. Go ahead and lay that leg down for me. Perfect. Any pain or discomfort? No? Perfect. Okay. And then the final test is a specialty test. It's called McMurray's. But with the McMurray's test, you're doing the valgus and the vagus repeatedly trying to recreate pain. So you would just be going back and forth, basically trying to repeat any pain that that patient would have. So you would be doing that bilaterally as well, just repeatedly making that movement. Okay, perfect. All right, Cadence, let's scoot up. We're going to do the hips now. Stand on up. All right, so with hips, we're checking for symmetry as well. Sometimes you have to palpate a little bit just so that we can feel where it's at. We also are checking for the anterior superior iliac spine. It's called the ASIS, which is kind of up here on the pelvic area. Go ahead and turn around for me so we can show this part. I'm not going to try to tickle you, that way you're on camera here. Okay, so kind of in the base of the spine here is your sacroiliac joints. And then you also have your posterior superior iliac spine, which is your PSIS down here. And then the greater trochanter is where the bone, the femur bone, connects right into the hip. It's kind of that external part of it. So we're just feeling those to make sure there's no pain, discomfort, any signs of mushiness or cracks. Okay, go ahead and turn around. And then what we're gonna do is, we're gonna lay back down for range of motion for hips, I'm sorry. Okay, so with this one, we're gonna flex one knee at a time, and we're going to flex it up at 45 degrees, and then we're gonna rotate it internally and externally for checking for hip movement. There's that one, perfect. This leg, internally and externally, okay. And then we're also going to check for flexion of the hip, which would be flexing up and extending down. So flexing up and extending down. Okay, and then we're going to check for abduction and adduction. So with that, we're going to hold her leg here and gently go to the side. We want it about 60 degrees. And then we want to see if it can adduct in about 30. So again, we're going to adduct out about 60 degrees and then abduct in for about 30. Perfect. Okay, so the next step would be what's called the Thomas test. So Cadence, if you can, grab your knee, and we're gonna pull it up to your abdomen with your hands. Perfect. Okay, let's do the other one. Any pain or discomfort with that? No? Okay, awesome. And then the next one is the Patrick's or the Faber. With that, we're going to take and put the foot on the quad over here, and we're gently gonna push down on this. Basically to go in like an Indian style type position to check for any pressure. Okay. Let's do it on the side here also. Okay, down. Okay, perfect. All right, so Cadence, let's stand up. We're gonna do your spine now. All right, turn around. Perfect, we're gonna go this direction. All right, so with the spine, we are checking, we always check when they're standing up. So this would be her cervical spine up here. And we're checking also from the side to see if she has any lumbar lordosis or if she has any dorsal kyphosis going on. So it's best to evaluate from the side, which she doesn't, so that's a good thing. We're checking the heights of the shoulders for symmetry, as well again as the iliac crest of the hip. We're checking to make sure that they're symmetric in height. And then we're not going to record it, but we also want to make sure that we're checking to check for the skin creases in the buttocks area to make sure that they are present. Okay, let's go ahead and turn this away just so you're not bending down in front of the camera and away from that. We're going to do a spinal evaluation. So we just have the patient gently bend over about 90 degrees. You don't have to go all the way, right there. And we're feeling the spinal column to make sure that it's in line and it's straight. We're checking for any curvatures, any signs of scoliosis, which she doesn't have anything. Perfect. Okay. And then, so we went forward a little bit. Are you able to extend back? Perfect. You can go much further than most people. All right, what about going down and touching your toes? Perfect. Most people, again, 90 degrees is great, but she can go all the way to the ground. Okay, so for the next part, let's turn around again so you're on the camera here. We're palpating the spinous process, and we're feeling down for the intervertebral spaces. And we're just going down the whole spine to feel for that. I also did it when she was bent over for like scoliosis, but I also checked it just now standing up. And then we're gonna go ahead and percuss the spine with the ulnar side of the hand. Okay, perfect. All right, so Cadence, this next part, I'm gonna sit down a little bit to help stabilize you. So let's come this way, perfect. Okay, my hands are gonna just be here. If you can, lean to the left and the right. We're gonna go about 35 degrees, perfect. What about slightly towards me? Bend in a little bit, perfect, thank you. And can you twist at your hips, left and right? Yep, at your hips. So upper body at your hips. Hips are gonna stay still, just twist your upper body. Perfect, thank you. All right, so the last part, we're gonna have you sit on the edge of the bed. And then I just wanna make sure if you can raise your legs straight out and up. Perfect. All right, well thank you. That completes our musculoskeletal. Oops.